formation of the platelet flood. That's what we're talking about. Okay, so if you have a male that has unexplained bleeding despite a normal platelet, what test best evaluates their functional platelet abnormalities? Yes, sir.
Ma'am, could you please use the microphone?
Oh, yes. Okay, can you hear me? Okay, so if you have a male that has unexplained bleeding despite a normal platelet count, what best evaluates functional platelet abnormalities? Starts with the platelet, PFA, platelet aggregation. Okay. I'm sorry? Oh. Okay. If we have a patient that has a wound on their leg, okay? And this person has this wound that's not healing and they deny any history of bleeding disorders. Their hemoglobin is normal, their platelets are normal, their PT is normal, but their APTT is high. So what are you looking for? What factor is affecting that? 7, yes. So an isolated prolonged APTT with no personal family history of bleeding disorders can initiate a deficiency in factor 7. Very good, y'all. I think I talked about this, but I'm gonna say it again. All right, so you have a patient has bleeding and chronic wounds and being evaluated for a potential coagulation disorder. You notice that their factor 13 is low in their coagulation study. What does that indicate to you all? Fibrin, okay, is what? The fibrin clot is what? So the fibrin clot is unstable. So the low factor 13 level, which is at 30%, is indicative of a factor 13 deficiency, which is crucial for stabilizing fibrin clots, okay? And usually in these type of patients, their PT and their APTT are gonna be normal. All right, so which test is good for the extrinsic and the common pathway? PT in the intrinsic pathway? When we think of hemophilia, what factor are we looking at? 8. And what are the tests that distinguish hemophilia A from hemophilia B? Remember? So we have the, yeah, there you go. Say it again. Say it loud for the people in the back. Yeah, 8, 9 studies, correct. Okay, so if you mark factor 8 only, I'm not going to give you the point. So make sure you're studying both tests, okay, 8 and 9. You will get that answer correct. All right, so for those patients that are on Coumadin, what is that test that you were going to test for? INR. Okay? Good. All right, the difference between the DVT and a PE. PE is what? In the lungs, DVT in the legs and the pelvis. Yep. We already talked about factor 8. Okay. And that factor 9 and factor 8, talked about that. Okay, talked about that. Okay. All right, so let's go back through lecture 1 very quickly. I want to make sure that I made sure I hit everything I'm supposed to hit. All right, so what is the difference between plasma and serum? Yes, plasma with Klein factors versus serum. Right. Remember we talked about ME ratios. If that ME ratio is greater than 7:1, what are we thinking? This person has elevated white blood cells. That's what? Infection. Correct. Okay. What is another term for polychromasia? Close. Reticulous, yes. Say it louder, ma'am. I can't say it, that's why I wanted you to say it. See? Reticulocytosis, okay? So just know, good. Right. We talked about primary hemostasis. I think y'all got that down. Okay, why is it we don't want to run a whole bunch of tests? You got a patient come in, you want to run thyroid, you want to run a lipid, you want to run a CBC, you want to run a platelet. What are the harms with that? Okay, remember we talked about point of care testing. We have our 3 complexities, which are what? Minimal or waived, moderate, and high complexity. And what is that subcategory within moderate? PPM, that applies to you all. And so what are some PPM tests that you all can run as PAs? Wet mount, okay. And what are some things we can find on a wet mount? Trichomonas, fungal elements, yeast, good. And what is that test that we run on pregnant females? Burn testing, good. If we're looking for, if we know a female can get pregnant, what is that test? HCG. Well, HCG is a pregnancy test, but what is the PPM test that we use after coitus? Postcoital. Yes, right, that's right. Okay. And what are the requirements for a minimal or wave testing? What are the 3 things that it needs to have to be a point of care test? Easy. Mm-hmm. Accurate.
No risk.
No risk, no harm, and it's simple. That's right. Okay. Thrombopoietin is what? Okay, it does deal with that. It is a hormone produced in the liver and kidneys that regulates platelet function. Good. And when we see the term erythropoietin, that means what? Stimulates that red blood cell production. Okay. Okay, and just as we talked about polychromasia and reticulocytosis, that means what? What are the lab techs seeing on the slides? A bunch of immature RBCs, and that's indicating to you what? Something's going on, right? Maybe some type of anemia. That body's trying to produce those RBCs very quickly. Okay. We talked about platelet aggregation. What is another term for platelet aggregation? Okay. But the term I'm looking for is aggregometry. Okay. All right. And what have we been studying for this block? The study of blood, which falls under what section of the lab? Hematology. All right, and what are the 2 common tests that we test in hematology that we talked about? CDC and your coagulation studies, okay? And what are the tests that are involved with your complete blood counts? Hemoglobin's 1, platelet, RBCs, hematocrit, MCV, which is what? Volume, MCH, MCHC, and then remember the rule of 3. If I give you a hemoglobin, how do you determine the hematocrit? And the got it, he got it. Yeah, You got the idea? Good. See, I told y'all gonna do so great on this test. Yeah, so good. You said what?
The one guy thing.
All right, ferritin, what is that a key lab marker for? Iron stores. Good. All right, we talked about factor 12 levels. All right, what are the tests that are found in the BMP?
So it's all the CUA,
Basic metabolic panel. And so how many tests are in there?
the CBC plus.
There's no CBC in the BMP. The BMP is a chemistry and it only testing the plasma. So remember, CBC is gonna test those formed elements of the blood, okay? But when we're talking about BMP and CMP, we're looking at the plasma, so that liquid portion of the blood, okay? So what are those 8 tests that are in the BMP? Glucose, BUN, oh, Chem 7. I ain't heard that term in a minute. Are you a previous lab tech? Okay, yeah, that's an old term. We're not gonna be testing on Chem 7, but yes, that is correct, okay? BUN, creatinine, glucose, what else did we say?
Sodium.
Like some electrolytes, let's break down those electrolytes. Potassium, calcium, sodium, carbon dioxide, good. All right, and then we have the CMP, which is that comprehensive metabolic panel. That's additional, how many more tests?
Six.
Okay, and what are those?
Albumin.
The
Okay.
albumin,
Okay,
the bilirubin,
Okay.
Carbon phosphate.
amino transfer.
That's correct, that is correct. So, if you are in your aid station, right, and you have someone that is exhausted from PT, and you draw labs on them, what is something that could be falsely elevated? Creatinine is one, that's correct. CK, what else? Your LD, because that would end up testing for that muscle breakdown. And also realize too that, not just in the blood, but that creatinine will show up in the urine as well, okay? Any questions on that? Y'all got that. All right, let's see. We talked about yeast. What is another term for that, if we present it to you all on your reports? If we find yeast on a wet mount, what does your patient have? Candidiasis, vaginal candidiasis. Very good. Okay. We talked about the red cell indices. All right, so remember that microcytic anemic algorithm. If your MCV is less than 80, what's the next test that you would need to pull on your patient or draw on your patient? They already had a CBC, you saw that their MCV was low. So then your next thought or your next procedure is to what? It's three labs you want to draw or look at. Yeah, ferritin. You want to look at the iron and the TIBC. And if the iron, the ferritin, and the TIBC is high, what are you thinking of? My favorite anemia, remember? Iron deficiency anemia, y'all. Come on, as many times I said IDA these last couple weeks. Okay. Oh, okay. Let's go back to point of care. There is one more test that I didn't talk about, something that's prominent in children. Because you know, kids like to touch everything, right? They touch it, they put stuff in their mouth, they're scratching. Pinworm test, and how is that conducted? Yeah. And what is that species that's found? What is it? Enterobus vermicularis. Good. Very good. All right, so if you have a patient that has a viral infection, what kind of white blood cells are we seeing? Lymphocytes, good. Eosinophils are associated with? Good. Rhinitis, allergic reactions, good. All right, now we're doing the opposite, macrocytic anemias. So you already had a CBC on your patient and that MCV is greater than 100. What are the 2 tests that you need to run? Folate, B12. Folate and B12, okay? And if the folate and B12 is low, sure, good enough. You got it. Y'all got the concept. I just wanted y'all to know what test to run if you get that result. So I think you're good there. We talked about coagulation cascade, Fern testing, good. Rule of 3. Okay, what is an RBC membrane defect? RBC membrane defect, what kind of cells will be on that differential?
C6PD. You're talking about C6PD, look like the bites.
Well, close. Spherocytes, okay? So associate RBC membrane defects with spherocytes, okay? And I think that came from lecture 4, okay? Yeah, lecture 4. All right, we talked about warfarin and coumadin, how that's associated with the INR testing. We talked about CMP. Okay, when we talk about shift to the left, what does that mean on the differential? Bands, and bands are essentially what? Immature white blood cells. Good. What are those cells that are associated with sickle cell anemia? Trypanocytes, good. And the cells that are associated with thalassemia? Target cells or podocytes, good. Hey, y'all gonna kill it. And what was my favorite cast, y'all, in the urine?
Waxy cast.
And what is waxy cast associated with? Chronic renal disease. Good. All right, do you remember your crystals that are found in acidic urine? What the names were?
Calcium oxalate.
Uric acid and calcium oxalate. And what about those urines that are found in alkaline urine?
Calcium bicarbonate.
Oh, real quiet.
Magnesium phosphate.
Yeah. Yes, magnesium phosphate, great. What's another one?
Calcium phosphate.
Calcium phosphate and ammonium biurate, okay? Ammonium biurate are those thorn, apple, or spiky, has a thorn, apple, or spiky appearance. Okay, side 6 cell, we talked about that. Okay, so let's get into those leukemias. If I tell you that there's a child with greater than 20% lymphoblasts, what are you thinking? What leukemia does that child have? Or you're,
Non-Hodgkin. Is it non-Hodgkin? No, that's not.
not non-Hodgkin's. This is specific to children.
Acute lymphocytic.
ALL, which is what? Acute lymphocytic leukemia. Let's go the opposite. If we have an older patient, and I say that this person has greater than 20% myeloblasts, what are you thinking? AML, acute myeloid leukemia. And now the ones y'all keep saying, if I say, hey, I found Reed Sternberg cells in the slide. Now it's Hodgkin's, y'all, yes. Y'all love that term today, I don't know what's up with that. Okay, we talked about hemophilia A and B. Okay, so some blood testing source errors. So if we say there's hemolysis in our tubes, what does that mean? Rupture RBCs, and we got all this hemoglobin stuff floating in our plasma. Lipemia, excess fat. Icterus, bilirubin, and that's associated to what disease? Jaundice, good. And cold agglutins, I didn't go too much into that, but that is just a risk of hemolytic bile. Okay. All right. So remember the ESR. What is that ESR test? What does that test for? Okay. So if we have a low number, that's indicating
Inflammation.
Anemia.
okay, yeah, normal, right? If it's abnormal, the ESR will be elevated. Okay. What do we know about polycythemia or polycythemia vera? It occurs where? And what's its hallmark? what do we see on that CBC? Lots of red blood cells, so everything will be what, elevated, right? So high RBC, high hemoglobin, high hematocrit. Okay, we talked about that, okay. Anybody have any questions, concerns, or comments? Because I told you my slides are acting real wonky, but I will make sure to update that link for you all. So we have the block review, so I'll update those slides, and then I have another slide that has a whole bunch of questions if you just need to have that repetition. Does anybody have any questions for me? Okay, don't let me down on Friday, y'all. You see my boss is watching me in the back. Y'all better make me look good. They're just, okay, all right, I will see y'all Friday.